up, so we can start now. Wonderful. So good afternoon now, everyone. Thrilled that you're all able to join us. And I'm going to begin with a land acknowledgement before we get going. And I would like to respectfully acknowledge that we are in Mi'kma'ki, the ancestral and unceded territory of the Mi'kma'ki people. And this territory is covered by the treaties of peace and friendship, and that we are all treaty people. And we acknowledge the histories, contributions, and legacies of the African Nova Scotian people and communities who have been here for over 400 years. So nice to be together. And we have a good crowd today. I'm Dr. Megan Aston, and I'm director of the Center for Transformative Nursing and Health Research. And today is our first Wednesdays at noon kickoff for the year. And Julie Berry, I think everyone knows Julie, saw her face. Julie, manager at the School of Nursing for Research. And so, you know, we work closely together as we're working at the center. Last year, Dr. Marcia Campbell-Yeo was the director, acting while I was away. And it's really exciting to be back. So I just love these meetings, get to see everyone, learn all sorts of things, and share ideas. So to begin with, I'm going to talk a little bit about the center, just for those people who are new and even people who have been away for a while or have been coming for a long time, just so to see where we're at and where we want to continue to go. So I think a lot of people do know that the Center for Transformative Nursing and Health Research has been around for quite a while. And we are now starting to do more online things rather than having everything in person. So I think pretty much everything is online now. We have a great website and a new logo that came out last year. And so just generally overall, the center, and you can read our mission and policies and statements, we're here to really support research and scholarship. So whether you're actually doing research or using research or evidence-based practice, it's all revolving around that. So we welcome everyone, and we like to do that in a variety of ways. So the transformative piece is purposefully chosen, and you will notice that throughout the university, and also our new strategic plan is also using that word transformative. So we really want to use and think about that very purposefully, like what does that mean? And I know as researchers and scholars, we are always looking at our clinical placements, where we are as healthcare professionals. So it is Faculty of Health, Dentistry, Medicine, but we do also extend beyond those faculties and also beyond our university. So the more the merrier, and we are here to try and facilitate connections. I think that's a wonderful way to hear what people have to say, but also to bring people together, not just at Wednesdays at noon, but we do have other activities throughout the year to facilitate those types of things. So I know that Julie shares a lot of information and ensures that things are actually on our website, but then you will receive lots of emails. So that's a bonus to be able to sign up, and that's one thing that you will see. And it's not just events that we're doing, but Julie shares what our partners are also doing and vice versa. So just trying to get those connections with our partners. So we do find that over the years, there's been a fair amount of support for students, just different types of learning, connecting students to other students and also faculty. We do have volunteer experiences. And so sometimes we will have faculty post that they are open to sometimes pay, but also to offer volunteer opportunities to work with them on different research projects. So I know everyone's busy, but sometimes those opportunities can come around. So I just wanted to note that for other people who might be new, and that can be faculty all across the university. So we like to facilitate that. We've also had panel discussions, and sometimes those are just hot topics that have popped out. And, just talking to myself and Julie and the executive will say, wow, that's a really important thing to think about, and we'll gather experts in the area or people who are interested in speaking about that. So those are fun. And we've been able to record all of those, and then put them up on the website or through YouTube, and those can be viewed afterwards. Workshops and different presentations. So we do have those. You can come to them live, and they're also recorded. And I know Christine Cassidy and Elaine Moody, they did, I know there was one on posters, and I think there's another one too. I'm forgetting which one it was. And then obviously we have our Wednesdays at noon. Really excited, and that's been ongoing for many, many years. So a variety of presentations, students, faculty, partners, and Salma is going to be our first presenter of the year. So absolutely thrilled to have you here. Dr. Margot Latimer is Chair for Indigenous Health Research, and her position is connected with the center through the Faculty of Health. And so she's doing a lot of very supportive things with Mi'kmaq people and students, and really pulling students into School of Nursing and having that support there. So we rely on Dr. Margot Latimer and her students and partners to help us and to inform us of Indigenous ways of knowing. Equity, diversity, and inclusion is an important part of what we're doing. That is in our mission statement, and just to be cognizant of what that actually means, and to ensure that we are being held accountable and actually implementing and paying attention to EDIA. And we have an executive. A number of us are across the Faculty of Health, and we also have students. So we do have one PhD student right now, and we would love to have as many graduate students as we can, but we're specifically now looking for a master's student. So any of you out there, spread the word. Just email Julie. I think Julie had put out a call, and we would welcome you to do that. So just really wanting to reach out as much as we can over the next year, just to help facilitate everything I had just mentioned to you. And it would be, as I mentioned, faculty across not just Dalhousie, but certainly outside of Dalhousie too. So I'm just going to stop there and see what perhaps questions, comments, feedback. I know that it was Julie and Jennifer Lane had sent out a questionnaire. I think it's 2 years ago now, because we just really need to have feedback, just to see what are we doing that you like, suggestions on ways that we can go forward. So I'm just putting that out to people. If you would like to say anything now, we do have some time to have a bit of a discussion. So I'll just stop talking. I'll let people think, and feel free to jump in. So you can turn your microphones on, put your hand up if there's a whole bunch of you. And if you don't have a comment right now, please, please, please feel free. I love getting emails about the center, and to be able to talk about that. So we would bring your ideas to executive, and yeah, we'd love to implement and move forward. Julie, I'm going to turn it over to you. So that was a big introduction, a big welcome, but would love to hear from you.
The only thing I would say is we've got quite a lot of members, but it would be good to get more active members and find ways to engage them more. So again, as Megan said, if anyone has any suggestions of things that we can do, things that we can do better, if you receive too many emails, if you don't receive enough, it would be great to get some feedback from everybody. And as I said, suggestions of ways that, particularly say, with new faculty coming on board, are the things that they're looking for that don't exist. We've started research training this year. So we're going to have a series of training sessions. The first one is on the 27th on Crone River. So we have the finance people coming down to explain this lovely program to everybody with all the questions that people have. And then following on from that, we're going to have one on Red Cap. And then we'll do one in the winter on ethics and Romeo which Carly Bamford, who's on the call, is going to lead. So we're going to start moving to helping people out and helping them navigate the system. So that came from suggestions from members. So again, if you have any suggestions, if you have any wishes, Megan's really good at pulling panel discussions together. And I mean, we have one online, which I point people to, which is for new faculty. And it's from a couple of years ago, but it was how people built up their research program. So we had Sarah Kirk and Grace Warner from occupational therapy and Sherry Price from nursing, just talking about how they started out and how they built their program of research. And again, that would be, I think, very useful to new faculty. But those kind of things, if you have an idea, bring them forward and we can facilitate them. So I think that's it.
Great. Okay. Well, thank you. And if no one has questions, comments at this point, let's turn this over to Salma. So I think you have some slides and you're going to do your presentation about your research. So thrilled to have you here.
Yeah, thank you. Thank you very much. I think I'm still. Thank you very much. I will just share my slide.
Yeah, I think just, yeah, let us know if you have access or not.
Yeah. Yeah. Can you see my slide now?
Almost. It's still a white blank screen. Oh, yes, now we can see them. I think it was just delayed. Yes, we see them.
Yeah, so hi everyone. Thank you very much for coming today. I am Salma Almukhaini. I'm a PhD candidate, hopefully until next week. I'm very excited today to share my PhD research with you titled Role of Development and Utilization of Masters Prepared Omani Nurses Working in Clinical Setting, a Multiple Case Study. In this presentation, I will start by giving you brief background and literature review about my topic, and then I'll talk more about my research question, method, result, implication, and limitation. So masters prepared nurses have been utilized differently within and across healthcare settings. A lot of them have been utilized as advanced practice nurses, like clinical nurse specialist or nurse practitioner, and also some of them have been utilized as a nurse leader, educator, researcher, and also as specialized nurses. Many positive outcomes have been associated with the care provided by these masters prepared nurses, including decrease of hospital stay, waiting time, improvement in chronic disease management, decrease in costs, and also high patient satisfaction. These nurses are really important in Arab country, where I did my research. I did my research specifically in Oman. So healthcare systems are transforming in Arab country because of the aging population, increased complexity of chronic disease, the desire to shift care from hospital to community, to the desire to decrease cost as well, and also to enhance status of nursing as a profession. So masters prepared nurses are well positioned to contribute substantially to healthcare system transformations in Arab country and to face these challenges. More specifically, in Oman, we have around 130 masters prepared nurses currently working at Oman governmental healthcare system. And also we have 3 masters of nursing education program. The first one started in 2016. So we anticipate that the number of masters prepared nurses will increase in the coming years. Oman has developed, as part of strategic planning, 5-year plan for health development. And that plan aims to increase quality of healthcare services, quality of patient care, and patient safety. So we think masters prepared nurses with their advanced knowledge and skills are capable to address these objectives, but nothing is known regarding the current utilization. I mean by utilization, the current roles and roles activities of masters prepared nurses, how their role were developed, and factors for facilitator and barriers that impacted their utilization. Advanced practice nursing role are evolving in Oman. The first nurse practitioner joined the service in 2016. So to understand more about advanced practice nursing role, which is one of the main role of master's prepared nurses, we conducted a scoping review using JBI methodology to map and synthesize available evidence about advanced practice nursing role in Arab country, and we included 35 sources. There are a lot of interesting findings there, but the main thing is that we really need nurses with advanced to practice as advanced practice nurses because of shortage of physicians both in number and specialty, high prevalence of non-communicable diseases, decreased costs, to increase use because of increased use of technology, and also to enhance nursing as a profession. Advanced practice nurses are not well utilized in Arab country because of different cultural and structural factors, including the nurse's desire to practice the role, lack of role clarity, lack of job description, lack of legislation and regulation to regulate the advanced practice role, lack of understanding and support from healthcare providers, and again, the status of nursing as a profession. And from that scoping review, we identified some gaps. So we still need more empirical evidence about how the roles of these masters prepared of these advanced practice nurses, how their role were developed, and also what type of role activities they are doing. So this way I did my research to know more how masters prepared nurses, including those who are working as advanced practice nurses, have been utilized in Oman. And to answer, my research answered the following research question. How are masters prepared Omani nurses utilized in clinical setting in governmental healthcare organizations in Oman? How were their roles developed? What factors have facilitated and hindered their utilization and role development? And what are the perceived impact of their current utilization? I use multiple case study as a methodology to have or to develop that in-depth understanding and analysis of the role development and utilization of masters prepared nurses. I selected 2 cases, which were Ministry of Health and the University Hospital, because these 2 are the main governmental healthcare provider in Oman. And for the qualitative data, I purposefully select 1 tertiary care hospital. My study was guided by PEPA and PEPA Plus framework. Because it's a case study, I collected data from multiple sources from both cases. So I conducted a descriptive survey targeting masters prepared nurses to know what type of role they are doing and what type of role activities. I use convenient sampling and I analyzed that using descriptive statistics. I also collected qualitative data as some structured individual interviews with masters prepared nurses. In both cases, nurse administrators and policymaker, co-workers, and nurse educator, in addition to official document. So as you can see, I collected the data from 5 nurse administrators in both cases and 4 co-workers from both cases. For the analysis of the qualitative data, I use within case and cross case analysis, and I use hybrid thematic analysis for the within case analysis. I will present here the main findings from the survey, because there are a lot of findings. Really, maybe the time will not be sufficient for me to go through all of them. But I got a good response rate, 59%. And from the survey, the findings indicated that masters prepared nurses are mainly utilized in management, few of them utilized in clinical education, and very few in as clinical specialists. So as you can see, 50% of the respondents have a title related to management. Only 8% had the title of clinical nurse specialist. I also asked in the survey about the focus of masters prepared nurses' current role. So as you can see, 34% indicated that their current role was a combination of clinical and leadership, and 32% said their current role were prominently in leadership. And I think only 10%, I cannot see how much here, but only 10% involved in direct patient care. Regarding their satisfaction about their current utilization, 48.8% believe that they are currently underutilized, and only 22.9% they believe they are well utilized. From the survey, we identified different facilitators and barriers. The main facilitator was administrator support, and the main barrier was lack of clear job description. From the qualitative data, again, a lot of data from the qualitative data from the interviews and the document review. And I will present here the finding from the cross-case analysis, which reveal a lot of commonality between the two cases. I will highlight the similarity, but if there is any differences, I will highlight them, and it will be also highlighted in the slide. So regarding how the role of masters prepared Omani nurses were developed and how they are currently utilized, we identified 4 themes: drivers of master's preparation in clinical settings, trajectory after graduation, role development and scope of practice, and current utilization of master's prepared Omani nurses. And the first theme, drives of master's preparation in clinical settings. In both cases, policymaker indicated that they sent nurses for master's education to meet organizational needs, like to support management, to train other nurses, to support specialty service, and also for them to integrate or implement research in practice. However, master's prepared nurses related their master's education to their own personal and professional goals. So they said, we did a master to increase our knowledge, skills, and to have higher managerial role, and also to meet accreditation standard, and also to enhance the nursing as a profession in Oman. Theme 2, trajectory after graduation. And again, in these themes, participants talk about the nurses' journey after they finish their master's education and they join the service. So it seems there was a mismatch in expectation between nurses and their nurse administrator. So nurses thought that automatically after their masters, they will be promoted to have senior managerial role or role in research, or they will have like extended scope of practice. But the administrator actually expect them to just go back to their previous position and to identify their own goals and objectives. So this is why the nurses felt their masters was undervalued, and there's like no difference of having master or not having master. So those who return to their previous position, some of them work proactively to extend their role by doing more initiative and try to utilize their knowledge and the skills. Some of them, they still have the same scope of practice, but more or administrative tasks were added to them. One change is that nurses from case 1, they said that the transition was not easy. There were challenges to prove they have adequate knowledge and adequate competency to gain the trust from the nurse administrator and from the co-worker. Once they got that trust, then the opportunity, like they have more opportunity to expand their scope of practice. Theme 3, I think this is the largest theme, role development and scope of practice. In this theme, we identified the different role for master's prepared nurses. So the main one, which is congruent with the quantitative findings, the majority of nurses utilize an administrative roles, and these administrative roles are similar in both cases, and it's well established. The second sub-theme is nurses in clinical education role. So this like clinical educator. So their role were mainly developed to support and to train, to mentor nursing workforce. And this role in case 1, it could be practiced by nurses with different qualification, while in case 1, only master's prepared nurses could practice as a nurse educator. However, the nurses in case 1 have more wider scope of practice, but in both cases, nurses say that their role is not well established. They have like a vague job description, and they have a lot of role conflict with the head nurses, because head nurses usually are the one who decide which course is needed and how to train nurses in the unit. And the role of nurse educator and also the specialized nurses, I will talk about them in a minute, were developed using a top-down approach. Another common role for not common, only few of master's prepared nurses will work as specialized or advanced clinical nurses. Those are nurses who work under specialty team. They call them specialized nurses in case 1 and clinical nurse specialists in case 2. However, they had the same scope of practice. The main difference is that the main difference is that specialized nurses, they say that their role is clear, while clinical nurse specialists, they said their role is not clear and they have like fluid scope of practice. However, the main reason to develop the clinical nurse specialist role or specialized nurses role is to save the physician time. And this is why physician played a major role in determining their scope of practice. Some specialized nurses, they work as a coordinator for the team. And some of them, they were trained to do advanced medical procedure that is usually done by physician. Theme 4, current utilization of master's prepared nurses. And this theme, the majority of participants in both cases said that currently master's prepared nurses are not well utilized, especially in research, in setting policies and regulations, and also in having advanced role. Only few said they are well utilized, and those are only work in management, like nurses with leadership role. And in case 1, which is the Ministry of Health, the nurses said they are overutilized because they have like multiple roles. And then addressing the research question, what are the factors that impact the role development and utilization? Again, from the cross-case analysis, we identified 3 themes: individual level factors, organizational level factors, and system level factors. Again, there are a lot of commonalities in these factors. Most of these factors have been identified in both cases. Theme 1, individual level factors. All participants in both cases agreed that the characteristic of nurses, including their knowledge, their skills, their motivation from doing a master education, is number 1 facilitator for their role development and utilization. Some nurses in case 1, they said, because we have commitment toward our community, this is what keeps us progressing. Theme 2, organizational level factors. We identify, I think, 6 sub-themes of factors that influence the role development and utilization. The main one is role ambiguity. And this barrier only reported by nurses in clinical role, like clinical educator and clinical nurse specialist, because they don't have clear job description. Another factor is administrator support. Actually, administrator support was identified as a facilitator and barrier at the same time. Some nurses, they said they really support us a lot, while a lot of nurses said, no, they didn't support us. We don't have enough administrator support. However, nurses in case 1, which is the Ministry of Health, relate that to qualification of administrators. So they said because they are not master's prepared, they don't understand our competency and they don't support us. And there are kind of power struggle between them. Other factors, I think this is one of the important factors as well, lack of career pathway and trajectory. And this factor again related to the nurses in clinical role. All nurses except those who are in management, they don't have clear career pathway. Like they don't know after 10 years what they will do. It's just if you are clinical nurse specialist, you will be clinical nurse specialist forever. There's no progress. And this is why some of these clinical nurses, like nurse educator and also clinical nurse specialists, they shifted to management because they want to progress in their career, which again impact the sustainability of their role. Other identified organizational level factors include interprofessional relationship, which was positive. So it was identified as a facilitator, lack of infrastructure, including lack of time, physical resources, high workload, and shortage of staff. And the last sub-theme is mismatched expectation. As I said, there's nurses believe there was no strategic planning for them. System level factors, I think the main and the most interesting factor here is that lack of regulation and organization of master's prepared nurses. In Oman, currently there is no board of nursing to regulate and legitimize nursing practice. And this is why some clinical roles like clinical educator and clinical nurse specialist was developed in certain hospitals. So clinical nurse specialist as a title just exists in the university hospital, and nurse educator just practice in that tertiary care hospital from the Ministry of Health. And this is why these nurses, they don't have clear job description, they don't have a career pathway. And also there is no association together and to unify master's prepared nurses and then to voice their, their issues and their challenges. Implications for policy, practice, and education. I think it's very important to know exactly why we need master's prepared nurses in each healthcare setting, like in primary, secondary, or tertiary care. And they should have like a defined goal for their role. And to do that, involvement of stakeholder is very important. Having advocacy from a nurse administrator is very important for the integration of their role. Again, one important implication is that it's very important for Oman now to think seriously about establishing board of nursing to regulate and to legitimize nursing practice. As you can see also, because some clinical nurses shift to management, so it's very important to design strategy to retain these nurses in a clinical role, and these strategies should be directed toward the identified individual, organizational, and system level factors. For education, I think the findings of this study could inform the direction of Master of Nursing Education program in Oman, and it's very important for education sector to think about establishing master's education that is directed toward preparing graduate for a defined advanced practice nursing role, like clinical nurse specialist role or nurse practitioner role. Here are the limitations. As you can see, I wasn't able to analyze the survey data for each case because I had like a low response rate. Only 12 nurses participated from a university hospital. So to maintain the confidentiality, I just analyzed and presented the findings as one set. And as you can see, also I collected the data from only one tertiary care hospital. So the data might not be transferable to other hospitals in the Ministry of Health. And this is why next future research should be focused in exploring the utilization of master's prepared nurses in other healthcare settings. These are the references I used. And thank you very much.
There we go. Sorry, I'm a little bit slow and delayed. Let's open it up for conversations. Thank you, Salma. Oh, wow, a lot of wonderful work that you have done. So thank you for sharing. Yeah, I'm going to open it up to the audience to see if anyone has comments or questions. And I think Marilyn, you have your hand up first. Go ahead.
Hi, Salma. Well done.
Thank you.
The one thing, Salma, that I thought the audience may not be clear on, in your slide where you have specialized nurses and clinical nurse specialists, and I'm not sure if everyone will have, if it's clear, the distinction between those two. So if you would share that, please.
Yeah, I think this is a very good question, and sometimes people get missed about specialized nurses and the clinical nurse specialists. So according to the ICN, they really publish their annual report in 2020, and they provide a very good information distinguish between the specialized nurses and clinical nurse specialists. So one difference is in the education preparation. So usually specialized nurses, they may have like undergrad or they may have like BSN graduate, but they have like a long year of experience in that specialty. Some of them, they received in-job training to be specialized nurses, so it's not always master's preparation. While for advanced practice nurses, it should be they should be master's prepared. So this is one. The other part also in their scope of practice. So usually specialized nurses work within specialty. They have like a defined goal, so they just work within that goal. While clinical nurse specialists, they have to work beyond, like they have to meet, yes, they have a defined goals, but they have to have more of system level involvement. So they are there to establish and to implement research also and quality improvement project. They could delegate tasks to other healthcare professionals, and also they can work in liaison with other healthcare professionals. So their scope of practice is wider, and they have like more autonomy in their role. And I think the third difference is in the licensure. So usually specialized nurses, they are just they have license, their regular license as a general nurse, while for clinical nurse specialists, usually they should have that credentialing or license, like they have to be licensed as clinical nurse specialist. So I think this is the general difference between the specialized nurses and clinical nurse specialists. However, in my study, I think the difference is just in the title. So they call them clinical nurse specialists in the university hospital, and they call them specialized nurses in Ministry of Health. But in the end, they are doing the same, usually like the same job. They are serving in specialty services.
Thank you, Salma.
You're welcome.
Yeah, does anyone else have comments, questions? Well, I'll throw one in. From a qualitative point of view, I always find that the quotes are so powerful and just really helps me to understand what the nurses are going through. So I'm just wondering, what kind of qualitative research did you implement?
Yeah, I use multiple case study.
Mm-hmm.
Yes, so for the analysis, I use hybrid thematic analysis. So I analyze the data deductively and inductively from the data.
Right. Yeah. Because I think, yeah, I mean, I don't see case study a lot. I know Danielle's on your committee and she does case study. So I just like to hear more about that. And just, did you like using that? Maybe just explain to the audience a little bit more about case study.
Yeah, so
it's helpful.
Yeah, thank you very much. I think one challenge of doing case study is the controversy. So there is no one way to do a case study. So you can't do it. Yeah, if you like scope the literature, you will see a lot of variations on how to do a case study. But the hallmark of the case study is usually you have a case, you have like the phenomena of interest, what you are trying to study, whether a people or organization or a process like decision making or role development, it should be bounded to the case. You cannot separate the case from the phenomena of interest. Like if you apply the case, if you study the phenomena of interest in different case, you will get a different result. So here, for me, I know that nursing role usually diverge across and within settings. So because it's bound to the context, I'm interested to study it in governmental healthcare organization. I call it as a case study. So if I study the role of nurses in private, I think I will have a different findings. But because they are really combined together, I call it a case study. And you can use one case or multiple cases. In my research, I use 2 cases just to have that broad understanding about the utilization of these nurses in the 2 main governmental organizations in Oman, because Ministry of Health is different than the university hospital. Each one of them have their own rules and regulations and financial resources. So I was interested to see what are the differences and what are the similarities between these 2 cases, and to know what are the lessons learned from one cases that will help to inform the other cases. I think, yeah, and what I like about the case study is the in-depth description and analysis that's generated from the case. And I think this is also one reason why I did a case study. But in the analysis, everything, I think I use thematic analysis, hybrid, because I have a lot of data. I conducted around 36 interviews, in addition of the document review and survey. And I use paper and paper plus framework to conceptually guide my study. So I feel that from the scoping review I did and from paper and paper plus framework, I have like some good basis to start with. So I identified some codes before analysis. And then I also continue coding until the last interview, just to make sure I capture all the inductive coding. I think that helped me a lot in saving time, and I think and give me also direction for the analysis.
Yeah, thank you. That's really helpful. And I think it's nice for people to hear that so that we can learn what it's all about and how to do that. Yeah, so are the organizations excited to hear your findings?
I think so. Actually, the nurses was really excited to participate in my study, and they said we are looking forward to know the result. Hopefully the result will inform the policy and practice in Oman to really utilize these nurses, because they have tremendous amount of knowledge and skills, and they are really willing to work and to improve the healthcare system. So it will be really good for the future of healthcare system and the future of nursing workforce to utilize these nurses for sure.
Yeah, fantastic. Yeah, I'll turn it over to the audience again, just to see if other people have comments or questions. Yeah, and was there anything else, Salma, that you would like to share?
You mean about my research or
anything else? We got a little bit of time, so if you wanted to, I know you were confined to a certain amount of time, but we have a little bit of time if there was anything else.
No, I think it was a very good experience for me to do multiple case study, although it's time consuming. There's a lot of data to analyze and to organize, so I think that wasn't easy. But I think what gave me the excitement to do the multiple case study is is that I really want to know what is the best practice to utilize these nurses. I know there might be not a lot of communication between Ministry of Health and the University Hospital, so it would be good to know how these two organizations utilize these nurses and what are the best way to utilize these nurses so they can learn from each other. However, there are a lot of commonality between these two, although they are two different organizations, but there are a lot of commonalities. So I think this might be related to the status of nursing as professional, or maybe the culture or the system in Oman. So I think the changes should be at the system level, not only within the organizations.
Perfect. Great. Well, okay. Well, thank you so much for your presentation. I've certainly learned a lot, and thank you for sharing, and wishing you all the best next week and in the future. And we look forward to more publications from you.
Thank you.
So, thank you. And I saw, Julie, you had just put up, or you have a slide for the next Wednesday at noon.
Yes, I was trying to do that inconspicuously and failed miserably. But the next week we have a talk by Marilyn McDonald and Erin Langman on JBI and everything to do with JBI, what the JBI Centre is. And then Marilyn's going to talk about one of her reviews. So we welcome everybody, and I'll be advertising it.
Great, and that's next week.
And it's in 2 weeks' time. So the 4th of October. Can you believe it's October?
Wednesday. Yes. 2 weeks. Flying by. Awesome.
Exactly. Okay.
Okay, well, thank you everyone for attending, and we hope to see all of you next time we get together, and even more people.
Thank you.
Okay, thanks. Bye-bye.